study published in 2015 examining the effects of opioids like morphine on survival time in lung cancer patients reported no difference. Both groups lived equally the same duration, even though those on high doses of opioids. Palliative care professionals are trained to give opioids according to a proper schedule and titration based on the patient's needs. When done right, it's very difficult for opioids to cause death. Opioid addiction is a common concern, and rightly so, as we see with opioid crisis in the United States. However, the proper and controlled use of opioids rarely leads to addiction. According to a high-level study in 2018, less than 5% of patients developed addiction when given opioids for pain relief. More interestingly, the incidence of opioid dependence was less than 1% in patients taking strong opioids like morphine. When prescribing opioids, palliative care doctors screen for risk factors and regularly review usage, looking for signs of increasing dependence. When a person is in the last phase of their life, often food and water are no longer essential as before, and they do not experience thirst or hunger. They would not have hunger pain or the discomfort of starvation. Artificial nutrition or force feeding through tubes don't alter the dying process and may bring about more complications and discomfort. We all want the best for our loved ones. That includes granting all their wishes. Some terminal patients feel comfortable in their own homes and prefer to stay there till the end of life. Not always is this possible due to many reasons, especially if certain appropriate treatment is not available at home and only can be provided in the hospital. This should not be seen as failure to fulfill your loved one's wishes, but an act of love to provide proper care in their best interest. It's important to look at the big picture and prioritize comfort at the end of life, not just for the patient, but for the family as well. Those were some of the myths associated with palliative care. I hope I've been able to clarify all that for you. But if you still have any doubts, please come and see me and we can discuss in detail. Thank you.